Hi, Kevin Henry, the managing editor of Dell Economics. Here today in Arlington, Texas. We're actually at Dallas Cowboys Stadium with my friend Vijay Sikka, and we're here at his Optimization Summit. And Vijay spoke a little bit earlier, and one of the things that I heard him say, and I thought it was really pretty profound actually, is that a lot of dentists right now, you're thinking their initial reaction with the economy is to raise fees. And you think that maybe they should be optimizing fees instead?
That is correct. Yes, this is a great time to optimize the fees because as the economy gets tighter, the number of patients who are coming into your practice starts to drop. Okay. So those who are coming in, you want to make sure you don't leave any money on the table. And number one. Number two, it's not about raising your fees. It's not about adding 15% to all of your fees or adding $15 to each one of your fees. It's about aligning them with your profitability. And now, that's a very interesting thought process. If you truly look at your fees and look at them as prices of products, you want to make sure that it's a competitive price and you want to make sure that it's consistent with the quality of delivery. So what the programs that we work with, Fee Optimizer for example, what it does is it allows you to align the profitability of each procedure of your fee, compare that with the network. We have a database of 55,000 sample dentists at zip code, and then that database and the analysis from your practice in terms of frequency, revenue, time units allows you to set up the fees in a way that it's not necessarily just raising all of them, it's about tweaking them to make it consistent with the profitability of your practice. Okay. So that the profitability can be maximized and the fees are optimized.
Okay. And one of the stories you shared earlier is actually a dentist, I believe you said was Buffalo?
Yes.
And you said that he thought one procedure was his main.
That's
main
correct.
Yeah.
Actually, this was a dentist in Cincinnati. And so when we first met this dentist, we asked him, "What's your most profitable procedure?" And he comes back and says, "It's veneers," and that's 4 years ago. And when we did the analysis, we found that Invisalign was actually his most profitable procedure.
Yeah.
4 years later, when we met him again, and we asked him, "Well, what's your most profitable procedure?" And he says, "Oh, it's Invisalign." But turns out, when we did the analysis, it was the ceramic crowns that were his most profitable procedure now. So profitability and procedure composition is constantly changing. And that is changing because of the demographics of patients who are coming to your practice, your procedures that you're comfortable with doing, and the lab costs, salaries, and all the other costs. It's a constantly moving, changing factor. And the best practices that we see today update their fees twice a year. And notice I don't use the word raise your fees, it's about aligning them.
Right.
And making sure that they're aligned with the way we practice.
Sounds good. I appreciate your time. Thanks.
Fantastic. Thanks, Kevin. It's a pleasure to see you again.
It's good to see you.